Hi everyone. In this lecture I'm going to cover type 1 error versus type 2 error. These types of error happen when there is a clinical study and the researchers are trying to prove that their medication is better than an existing medication already in the market or better than a placebo. So starting with type 1 error, which is another name for it would be false positive. So you may see false positive instead of type 1 error. And to better understand what type 1 error is, let's take this example. So in this example, we have the researcher, they're working on drug called drug A. Versus another drug that already exists in the market and it's called drug B. And what happened in this study, they were able to prove that drug A, their medication, is basically better than drug B, the one that already exists in the market. And that was due to incorrect mathematical error. So they were able to prove it, but it was due to error, mathematical error. So in this case, what happened, because their medication is better than the one that already exists in the market, basically, we rejected the null hypothesis. Where they were supposed to accept it because there was an error, and that because of that error we accepted this. So this was accepted, drug A was accepted, so it's better. So drug A in this case, basically what it means is better than drug B. It's better than drug B. So this is why they rejected, so the null hypothesis was rejected. However, the null hypothesis was supposed to be accepted because due to an error, this medication turned out to be better than the one that is already in the market, which is not true. And that's what type 1 error is. When we reject the null hypothesis incorrectly and we accept the alternative hypothesis. So to make it better, so null hypothesis was rejected when it was supposed to be accepted. So that's what type 1 error is. Now, how is the risk for type 1 error determined? So it's basically determined by alpha. And in the previous lecture, I did say that alpha is basically determined by the researcher. And we usually see these two values. We most of the time see 5% and sometimes 1% it's used. And there's some conditions. And I'm going to go over what these conditions are. So here, alpha is 5%, which means that the researcher going to the confident interval, they are 95% confident that their conclusion, their medication, in this case, their drug A, is better than drug B, the one that already exists in the market. They are 95% sure that their conclusion is correct. And that's what alpha indicate over here. So basically to have this conclusion, it's basically determined by p-value. So let's use blue. So p-value must be less than alpha, which is 5%, so 0.05, for this drug A to be better than the drug that already exists in the market, which is drug B. So the way it's basically determined, it's through this alpha. And sometimes you may also see type 1 error, and instead of called false positive or type 1 error, you may see it called alpha because it's related to alpha. So what happened in this case? In this case, basically, alpha, because it's 5%, so there is a 5% chance, or less than, actually, because they were able through an error to prove that their medication is better than the one that already exists in the market, there is less than 5% chance for type 1 error to happen. And that's why it's determined through alpha. So there is less of a chance, less than 5% chance for type 1 error to happen in this case. And that's why it's related to alpha. So how can we minimize this chance of error? So the way to minimize it, going back to the 1% over here, and I said I'm going to go back to the determining how can we use this, is basically if we choose 1% instead of 5%. So decrease in alpha, making it smaller. So using, basically, we can minimize the chance of type 1 error by using smaller alpha. So in this case, it would be 1%. So why would you say, well, okay, why would you say 1% would help decrease type 1 error? Well, here's why. Because if we use 1%, in this case, confident intervals, CI, we can say that 99% the researchers are confident that drug A is better than drug B, which is the medication that already exists in the market. So this one exists in the market, and this one is the drug that the researchers are working on. So when we have a confidence interval of 99%, this means that they are 99% sure that their conclusion is correct. So if we know that their conclusion is correct, 99%, which means that there is, so in this case, basically what's going to happen is that p-value is going to be less than alpha, which is 0.01. 1%, right? So there is less than 1% chance that type 1 error can happen. And this is why by decreasing alpha to 1%, we can minimize the chance of type 1 error. So this is type 1 error. Now, let's move into type 2 error. What does this type 2 error mean? So another name for type 2 error is false negative. So you may see this false negative used. So this is basically opposite of type 1 error. So let's take an example to better understand what type 2 error mean. So let's go to the same example that I used for type 1 error. So here we're going to use drug A, which is the medication that the researchers are working on to prove that it's better than drug B in type 2. So it would be, so what the researchers are trying to do, they're trying to prove that drug A is basically better than drug B, which is a drug that already exists in the market. So what happened in type 2 error basically is the null hypothesis is accepted. when it was supposed to be rejected. So here it's the opposite of type 1 error. Here we accepted the null hypothesis when we were supposed to reject it. So what happened in this case, basically, drug A did not make it to the market because the researcher could not prove that this medication, the new one, is better than the one that exists in the market. And what happened in this case, if they couldn't prove it, which was supposed to be proved, but they could not, the null hypothesis was accepted. So we rejected, or the alternative hypothesis was not accepted. So null hypothesis was accepted and the alternative was not. So, and it's type 2 error because it was not supposed to happen this way. Drug A was supposed to be approved and not disapproved. And how is type 2 error determined? So, here we refer to type 1 error as alpha. So type 2 error, type 1 is alpha, we refer to it as that. Type 2 is basically, we're going to refer to this as beta. So this is beta, we're going to refer to that. And what does beta mean? Beta, basically, it's the probability of type 2 error to happen. So the bigger the beta, the higher the chance type 2 error can happen. And it's basically done through an equation which is power equal 1 minus beta. Usually in the studies, beta is given the value of 0.1. So it's usually, so beta, it's usually 0.1 or 0.2. So what does that mean? So if it's 0.1, so 1 minus 0.1, it's basically 0.9. So if you have 1 minus 1 minus 0.1, it's going to be 0.9. And this is the power, which means that the probability of type 2 error to happen is 10%. And would be 20% over here. And power is basically the probability that type 2 error will not happen. So in this case, we have 90% chance that type 2 error will not happen. We have a probability of 90% that this error will not happen. And that's what 0.9 means over here. So how can we minimize type 2 error? So we can minimize type 2 error by increasing the sample. So increasing sample size. Now, let's understand what this means. So what does sample size has anything to do with type 2 error? So basically, let's take an example. So if I have an example in one of the studies, we have 1,000 individual, okay? 1,000 patient here, PT's patient, versus in another study, I have 10 patients only. So you see we have 1,000, here we have 10 only. Let's say when in this 1,000, 2 individuals, okay, had a side effect. So let's say they had major, or actually let's take this example as we're doing a study and there is a class and this class had 1,000 students. So we're going to change patient to student. So there is 1,000 students in one class for this study, and there are 10 students in this study. And the professor gave an exam, and on the examination, we had 3 people in this study, so 3 students got 100% on the exam. So 3 students got 100%, and the rest got between 70, so between 60, so 3, so 97%. Here we have 3% because of 3 students. Therefore, 97, which is the left from the total, 97% of the students got, actually let me make it a 100 just to make the percentage correct. So here we have in this research, in this study, 100 students in a classroom, which makes more sense than 1,000. It's hard to have 1,000 in one class. And 10 students in this one. Here, 3 students out of the 100 got 100%. The left 97%, they had between, let's say, 70 to 80%. Okay? In this example over here, in this study, we have 10 students. And what happened, same thing happened. 3 students got 100% on their exam. Therefore, 7 students, the left from the total, got 70 to 80. So what happened when we are determining the mean in this case, it's going to be shifted towards 70 to 80, even though in this example over here, the mean is going to be way closer to 70 and 80% in comparison to this example over here. The reason why, it's because we have 3 students over here who got 100, which is an outliers. So they're going to shift the mean all the way to that side. So they're going to shift it all the way to the higher value. So here it's going to be shifted higher value. So which is closer to 100% because 3 students got 100%. In comparison to this study over here, because most students, we have higher number, larger sample in this case, they got between 70 to 80. Therefore, it's not going to be shifted to 100, even though 3 students got 100%. It's not going to be shifted to that direction because most students got between this range, 70 to 80. And this is why, this is due to type 2 error can happen when we have a small sample size. It's because when we have a larger sample size, we can have a normal distribution curve. So in this case, we can have a normal, basically, a normal distribution curve. In this case, it's not going to have a normal distribution curve. It's going to be curved in this case because we have a small sample and we have an outlier. And that's why when we have in this case, so it's going to be hard when we have a small sample to determine that our medication, which is drug A in this case, is better than the one that already exists in the market. So by increasing the sample size, we can lean or move more towards the normal distribution curve. So therefore, decreasing type 2 error. And one thing to keep in mind, so let's say after 1 month or let's say after a year, I come back and then be like, okay, well, I have this conclusion over here, these 2 medication, is it false positive or false negative? So how can you tell, is it false positive or false negative? Let's say after a year, you're reading like an article and you're preparing, let's say for a journal club, and you see it says a conclusion that there was a false positive. Now, how can you remember is false positive type 1 or type 2 error? So here is a way you can keep this in your mind. So in type 1 error, basically what happened is that the researcher proved that their drug A, was better than drug B, right? That's what they did. However, that wasn't correct. And in this case, basically the null hypothesis was rejected. So to keep in your mind that type 1 error is false positive, we can remember positive mean that we can associate positive with drug A being approved. So it's a good thing that their medication was approved. That's actually a good thing. We want it to be approved if it wasn't by mistake. So if this was not by a mistake, we would have liked it to be approved, and that would have been positive. However, because it was not approved, because it was due to an error, that's why it's called false. So remember that positive mean the medication was approved when it was not supposed to be. So it's false positive. And that's type 1 error. In type 2 error, we have a false negative. So the medication was not approved, which is a negative thing. The researcher are feeling bad, they're not happy, they're having, let's say, negative emotion. This is how you can remember it, I guess. They're having negative emotion, and it's called false negative. So associating the acceptance with type 1 with positivity, and then negativity when it's not proven better than the one in the market. So this is how you can keep the difference between false positive and false negative in your mind when you're reading, let's say, an article or a study. So this is it for this lecture. If you have any question or comment, please leave them in the comments below. And thank you for watching.